we're really excited about what we're doing at Unyte, and it's a very purpose-driven company. We're all very passionate about trying to help as many people as possible out there. And really, from a high level, we have a very clear vision at Unyte. It's to help guide people to their true selves, to their best selves. Our mission is to create and build a suite of these types of effective mind-body solutions that can really help as many people as possible out there live happier, healthier, and more meaningful lives. When I looked at the meditation and mindfulness and relaxation training world out there, I saw a lot of great content and guided meditations, which is amazing. And then we saw some clinical biofeedback systems, which were kind of clunky and hard to use. So we thought this is kind of the perfect blend of art and science, the science of measuring your heart rate variability and your nervous system state. So you actually know, is this really working? How calm am I? And the art of great kind of content, guided meditations, and interactive experiences. And bringing that together, we thought was very unique. And that's kind of the impetus for Unyte. So, really what we're here to do is to make meditation, mindfulness, relaxation training easier to learn, more engaging, and more effective. And that's really what gets us up every day, and our purpose to try to help people who are struggling or who just want to try to enhance their health. So
as we would like to show you, and as Jason mentioned, there is meditation is an evidence-based method. I mean, there's tons of research that shows its benefits for anxiety, depression, negative symptoms from trauma. At the same time, all of us who try meditation, it is difficult and sometimes frustrating to learn. What we have learned over the past few years is that real-time feedback is an essential way to help you learn about yourself and to meditate more effectively. That's how interactive meditation comes into place. It's by combining biofeedback, heart rate variability biofeedback, which Derek will get into more detail just now, and immersive experiences to make meditation easy, fun, and effective.
So Relaxing Rhythms 2 is a 10-step guided meditation program. Each step includes an introduction to the theme of the step, a guided meditation, and then an event to play. So we just clicked on the 6th step here. So there was an introduction and then a guided meditation with Rick Hansen, the well-known psychologist who's written Buddha's Brain, among other books. So this is a guided meditation by Rick Hansen. So the idea is you would listen to this meditation, but for the purposes of this demo, we're going to skip past this, and I want to show you the event. So if we click on Start here, it's going to give us another quick little setup as to what this event is about, but we're going to skip it for now, and I'll just briefly explain it. The idea of this event is to get that balloon you see in the background there, get it to rise up and move towards us. And you do that by keeping your resonance score high. Good job, Marcelo. Oof, you did it. You did it. So look at that. Congratulations. So here's the completion screen, and it's going to give you just a few stats of how you did on this event. So it was average heart rate, average resonance score, and the time it took him to complete this specific event. Now this all gets sent to your dashboard, and you can track your progress over time. But before we show you that, I just want to quickly show you the settings menu, because I had mentioned the difficulty level. So we're just going to back out of here, go to the main screen, and click on settings at the bottom of the screen. A couple things I want to draw your attention to. First, the breathing cycle. Those circles were expanding and contracting. There were 5 seconds in, 5 seconds out, because we had our breathing cycle set to 10 seconds. Now, that's why I recommend starting, but for some people, if that's too long or too short, you have the option of adjusting that here. And below that is the difficulty setting. So we have it set at 4. That meant that Marcelo had to keep his resonance score above 40% in order for that balloon to come closer to us. But we can obviously increase or decrease that difficulty setting based on individual needs. This information is getting sent to the dashboard, and you can turn that off if you ever wanted to with the session sync button there. We're just going to back out and we'll show you what the dashboard looks like. So all we need to do is click on this little link at the bottom right corner. It's going to say, hey, you shouldn't want to leave this journey. We do. We want to go to our dashboard.
And one interesting thing that Derek mentioned is that with the same login, you can use your journeys on a tablet,
good point,
on a phone, on your computer. It all gets logged, right?
Yeah, exactly. So you can do one event on your PC, and you can go to your Android phone, do the next event, and it's all going to show up here on your dashboard. So right across the top, you're going to see Marcelo's total time that he's spent in the Unyte journeys. That's a long time, Marcelo.
Thank you.
And in the middle, the average resonance score, and on the right-hand side, the total amount of sessions that he's done. So below that, we've got some options. We have filtering options. So if we want to just see how he's done in one of the journeys, we can do that here. And then on the right-hand side, we can select a specific date range. Now, below this, we're giving, we see each of the events that he's done. And on the right-hand side, we see a graphical representation of those events. The cool stuff is if we click on one of these events, we can really dive in and see the details. So here's the resonance score, the fluctuations throughout that specific event. Here's the heart rate information throughout that event, and then the RR intervals, which is the heart rate variability, or the amount of time in between each event. Now, if you're a data geek like me, you can even export this data as a CSV file. Now, there's a few tabs across the top. We're on the dashboard, but the next one over is downloads. And once you have a Unyte account, this is where you would go not only to track your progress, but this is where you go to download all of our journeys. So as we mentioned, it's available on PC, Mac, and through here you can also get links to download it in the Apple App Store for your iPhone or your iPad, or the Google Play Store for your Android.
If you're a clinician and you're using this with your clients, or if you're a school counselor, you are actually able to create unique user accounts. And how do you do that? It's very simple. You actually can add the account or invite your client to join. As you can see here, I have a few accounts under my admin dashboard. So if, for example, if I wanted to see Derek's data, I can see all the sessions he's done over time. So I've heard from many clients that use this in their practice. They can see from the very first session, that baseline session, and they can see their clients' progress over time, especially if they have their clients using these programs at home. You're able to manage these accounts, add new accounts, and suspend as needed.
Great, thanks, guys. Hopefully that gave you some good insight into how the interactive meditation program works. So that's how it works. But now, is it effective? We're happy to share that there is a lot of validation for this type of biofeedback-based training over the last decade or so. We've got when we actually bought Wild Divine, we did a research literature review. We found that there are 100 mentions of Wild Divines and products in the literature. There were actually 15 studies where it was a direct intervention, where people actually researched how did this help people. And so there were a few I really wanted to highlight, and if you want more information, we have the full literature review, but just a few highlights for those of you who might be interested. One of them was there was a study done at the Mayo Clinic on emergency room nurses, and what they found was that obviously it's a very stressful job if you think of doctors, nurses, etc. What they found was that they used 15 sessions of the interactive meditation products 4 times a week for 4 weeks, and the nurses showed significant improvements in stress management, and they really enjoyed the experience as well. So it was a very positive outcome in terms of reduced stress for ER nurses. Another big one, we see a lot of research and a lot of clinicians using these types of tools with kids and teenagers. There's a specific study done in Australia on children with ADHD. And basically, they went through a whole program with biofeedback-based relaxation training, and found that it significantly reduced disruptive behaviors and increased focus in kids with ADHD. And a couple others just wanted to mention. There was one where pediatric patients, so kids were coming into a hospital, Boston Children's Hospital, one of the best in the US, and were really suffering from pain and other related symptoms. And with minimal exposure to even 1 or 2 sessions of biofeedback-based training, they had significant reductions in pain and anxiety. And so even in kind of a clinical setting, we often see this used when someone's suffering and maybe going through treatment, and this can be helpful as, you know, just a support tool, much like others can, to reduce the stress, the anxiety, and pain. And last but not least, a bunch of other studies on teenagers and anxiety, depression, aggression. There was one in the US that focused on kids 9 to 17, and they did 8 sessions of biofeedback and found significant reduction in anxiety and depression. Another one was done in the Netherlands with very aggressive teenagers in a special at-risk youth school, and they found significant self-reported and teacher-reported and parent-reported scores around reduced anxiety and aggression. So once again, if you want the full research literature review, happy to share that with you. Just reach out to us after. We'll give you our contact information and we can send it right on over.
Absolutely. We now specialize in evaluations. So we're doing very specialized neurofeedback with research cases and so forth. But when we do evaluations, we write a very comprehensive report, and we include lifestyle changes, things that you can do to facilitate your well-being at home. And I would really say 9 out of 10, it might be 10 out of 10. We recommend this program now very, very regularly. Again, I think people might get an evaluation and come in and they have good intentions and they want to get started in the neurofeedback, but they can't do that right away. They may be going on vacation. They may, have some financial obstacles. You can buy this program. The pricing is really very affordable. So it's an easy starter thing as well as a good ongoing supplement.
Yeah, definitely. I definitely do. I see that they're doing a little better in school, and that they're getting along better with their peers, and that they're kind of enthusiastic about trying the breathing exercises, and they don't get sick of doing them. It's kind of weird. You would think they would get kind of tired of it. And the thing they love about it is that they can challenge themselves. I'll have 10 kids in here eating lunch with me in my big room here. And they'll be playing games and making all kinds of noise, and somebody will be doing the coherence flow, and they'll be doing it for 3 minutes and trying to get a score, and everyone wants to have the highest score. And I don't post the scores or make a big deal out of it at all, but it's kind of interesting because the kids that get the higher scores are the kids that do well in school and get along with others more easily.
Thanks, Lauren. So as you saw some of the videos from existing clients, we have heard consistently from clinical directors, therapists, guidance counselors, there is a challenge to keep their clients engaged and compliant through existing treatments. So we have worked with a lot of mental health professionals implementing our Unyte products within existing treatments. And we have heard great feedback. We have heard increased client satisfaction, greater compliance in treatments, and most importantly, improved outcomes. And that is really by bringing biofeedback, interactive meditation, and combining that with existing treatments. Now, if you ask me, how do I do that? How do I integrate Unyte in my practice? I've seen it in 3 different ways. First one, as you can see on the slide, is through a pre-treatment training program. So I've seen a lot of clinics that they will allow their clients or set up their clients to use interactive meditation, be it on a tablet or on their own phone, or even in a computer or dedicated space, and they can calm themselves, practice some biofeedback and interactive meditation before their session. Another way is actually during session through a stress management training that you as a therapist, as a counselor, you can work together with your clients within the therapy session and integrate and get them to practice some breathing exercises within that hour session and continue with an at-home training program. I've seen an increasing number of clients that are recommending their clients to use it at home. And with the clinical dashboard, as you saw, you can actually track each and every session. So you can assign, for example, homework and get your clients to do interactive meditation sessions between the time that you saw him or her last to the next time you see them again.